Hello and welcome to this press briefing on this day, the 18th of March 2021. We are coming to you from the African Union Commission in Addis Ababa, and this press briefing is brought to you by the Africa Centers for Disease Control and Prevention, the Africa CDC. As usual, today we are joined by our host, Dr. John Kengasong, and also by Dr. Merawi. Both of them are from the Africa CDC, but Dr. John is the director of that institution. And he's here today to share with us critical updates on the COVID-19 response activities in Africa, as well as the progress that is being made towards implementing the COVID-19 vaccine strategy, as well as the joint continental strategy for COVID-19 response. And Dr. Merawi will come in after him to brief us on the situation in the DRC and in Guinea as regards to the Ebola outbreaks in those countries. So without much ado, I want to invite Dr. John to give us our briefing, but also just quickly to remind you that when we do come to the question and answer session, please utilize that number +251 945 502 310. Let me repeat it, +251 9455 02 310. You can also come in live and as well as utilize the question and answer section on this platform that we're coming through to you on. Well, without much further ado, let me invite Dr. John to give us his briefs on the COVID-19 situation in Africa. Dr. John, you have the floor.
Thank you, Wayne, and greetings to all and everyone who is on this platform today. Let me, first of all, start by thanking you for being very regular and committed to this platform that we use in sharing information on the COVID-19 situation on our continent. I'll first of all start by sharing our sincere condolence from the Africa Centers for Disease Control and Prevention to the people of Tanzania for the passing away of President of that country, President John Magufuli, who unfortunately, as we all understand, died yesterday, I believe. And our sincere sympathy and heartfelt condolence to his family and the people of Tanzania, as I indicated. And if we add that to the fact that just a few weeks ago, the Vice President of Zanzibar, which is also part of the United Republic of Tanzania, passed, is too much for that country. So we stand with them at this very critical time and very sad moments for the country. With respect to COVID-19 situation on the continent, as of 9 a.m. East African time today, over 4 million cases of COVID-19 have been reported, and that accounts for 3.4% of the total cases globally. The total number of deaths today stands at 108,000 deaths, and that is represents a case fatality ratio of 2.7. And if you put that in the context of the global pandemic, it represents 4% of all the deaths reported. Our case fatality rate, as I indicated previously, is above the 2.2 global average and has been that way for a couple of weeks now, which, as I indicated previously, has been the reversal of what it used to be. So when we look at the epidemiologic trends, that is comparing last week and this week, that last week was the epidemiologic week 9, and this week is the epidemiologic week 10. We observed the following. First of all, we have recorded a total of 66,000 new cases since the last time we spoke on this platform, and that represents a 3% decrease in the number of new cases. The highest proportion of new cases are from Northern Africa and East African region, and which represents 28% overall. The other regions numbers are as follows.